Where is Rampur Maniharan? Rampur Maniharan is a small village of 25,000 people tucked away in the rural landscape of Uttar Pradesh in India. And why is Rampur Maniharan special? Because in 2001, Bill Clinton, the 42nd President of the United States, came to sow the seeds of a quiet social revolution here. The Vinod Gupta Charitable Foundation is leading that revolution. Vinod Gupta founded the Bill Clinton High School and the Hillary Clinton Nursing School in Rampur Maniharan out of a desire to better rural communities.
We have seen incredible progress in medicine and healthcare in recent decades, but too many communities around the world don't have the opportunity to take advantage of these innovations. I'm so proud of what our nursing school in Rampur has done to bridge those gaps, develop the next generation of health workers, and provide high-quality care to populations in remote regions, and I'm so proud that this work was named for me.
Not too far back, Rampur used to be a typical Indian village, lacking opportunities and constrained by a mindset that confined its female population to illiteracy and menial labor. Slowly but steadily, with much-needed interventions, inspired by Mrs. Clinton's book, It Takes a Village, we have begun to open doors to a brighter life for them. The nursing school's campus is outfitted with cutting-edge technology and facilities. Many generations are being lifted out of poverty as a result of this education. Thousands of women have graduated and are now working in well-paying positions. The Institute's students actively participated in the challenging mass vaccination effort across the region during the extended lockdown in 2020, which is a source of great pride for the management. While hundreds of former students continue to make a difference in the lives of millions of people today, what is equally gratifying is how their own lives have transformed.
जब मैं 16 साल की थी तब मेरे घर वालों ने मेरी शादी कर दी थी। उसके 2 साल बाद मेरी बेटी हुई। जब वो बेटी 1.5 साल की हो गई थी तब मैंने अपनी पढ़ाई शुरू की थी। मेरी पढ़ाई करने के बाद आज मैं कम्युनिटी हेल्थ ऑफिसर हूँ। हम दोनों हस्बैंड वाइफ कंधे से कंधा मिलाकर कमा रहे हैं। हम लोगों ने अपनी क्वालिटी लाइफ तो इम्प्रूव की ही है और अपना एक घर भी खरीद लिया है।
As the saying goes, the journey of 1,000 miles begins with a single step. The goal is to persevere and keep going. It truly does take a village and a strong desire to make a difference in the world.
Please welcome to the stage, Kate Warren.
Hi, thank you. Good afternoon. I am Kate Warren. I am Executive Vice President and Executive Editor at DevX, who is a proud media partner for CGI. We are a news organization that covers global development issues. And really honored to be moderating this discussion today to highlight the importance of community healthcare workers. This is an issue that we've covered extensively over the years. And I think particularly COVID brought to light a real dearth of healthcare workers globally and really the critical role they play in serving on the front lines, filling gaps, and reaching the most vulnerable. I myself, I'm actually the daughter of a nurse, so I grew up seeing firsthand the devotion and impact that community healthcare workers have and the role they play in their communities. If it was an issue unfamiliar to you before COVID-19, likely it is one you are familiar with now. I think probably all of us have interacted with a community healthcare worker, whether it was getting a vaccine, getting tested, talking to someone about contact tracing. And it's really brought to light how incredibly important it is for reaching that final mile. While playing such a pivotal role in our healthcare system, community healthcare workers still do not receive adequate compensation, training, protection, mental health support. It is also not a surprise that majority of them are women. And in today's session, we are going to highlight that through a range of conversations with a diverse group of experts, The critical role community healthcare workers can play in public health and how we can better support them. We're going to hear some commitments from organizations that are doing just that. And if you stick around, we hopefully also have a little time for networking. But to kick us off, I am really excited and delighted to welcome to the stage the inspiring Dixon Chabanda, Chief Executive Officer of Friendship Bench. Over to you.
Thank you. I assume you can all hear me so I can move around. We have a global crisis, a global epidemic of suicide, depression, and loneliness. The World Health Organization tells us that suicide, for instance, is a leading cause of death amongst young people aged between 15 and 26. Just think about it briefly. Every 40 seconds, someone takes their own life by suicide. And if statistics is anything to go by, every other fifth person in this room probably knows somebody who took their lives by suicide. Depression affects almost 300 million people in the world today. Let me share another piece of statistic just to contextualize how big this problem is. The care gap, that is the proportion of people who actually have access to evidence-based care in the world for mental, neurological, and substance use disorders. You know, if you flip it around, 90% of people needing evidence-based care actually don't get it, predominantly in low-resource settings. But surprisingly, we're learning a lot about places like the USA, United Kingdom, where access to mental health services is in certain cases as bad as in low-resource settings. So when it comes to mental health, all countries are low-resourced. Having said that, my team and I have, over the past decade, been exploring, looking at ways of addressing this care gap, where close to 90% of people needing services are not accessing it, predominantly because we don't have enough psychiatrists, we don't have enough clinical psychologists. You know, in my country, Zimbabwe, where I come from, I am one of 16 psychiatrists for a population of approximately 16 million. We will never have enough psychiatrists or clinical psychologists for that matter. A lot of countries are no different from Zimbabwe. But we've pivoted over the last decade or so and come up with a solution that is ubiquitous in most communities, grandmothers. Before I talk about our little solution, which involves grandmothers, we do have some grandfathers as well, I must say. I would like to just shift slightly and share another piece of statistic that you might find interesting. By the year 2030, which is literally in 7 years' time, 1 in 6 people living in the world will be aged 65 and above. And by the year 2050, it is estimated that 50% of the global population will actually be people aged 60 and above. What we have done at Friendship Bench, that's the organization that I run, we have leveraged the lived experience of the elders in our communities, the lived experience of folks who have the battle scars of life, for lack of a better word, people who are rooted in their communities, who are the custodians of local culture and wisdom. And this is what we do. We train grandmothers in the basics of what is called cognitive behavioral therapy, which is a mix of problem-solving therapy, behavior activation, and activity scheduling. That takes a month. After a month, each grandmother is allocated a wooden park bench in their community, We facilitate referrals to the wooden park bench using social media and other existing agencies within the community. After 4 to 6 sessions with a grandmother, folks are invited to join a support group in their community, and the cycle continues. Last year alone, just over 1,000 grandmothers managed to reach out to over 100,000 people in communities across Zimbabwe. Now, the work that we do is rooted in research. We have close to 100 peer-reviewed publications, including clinical trials. One of our most seminal publications is a cluster randomized controlled trial published in the Journal of the American Medical Association, which shows that grandmothers provide better therapy than experts. Grandmothers provide better therapy than Prozac. So there are numerous interventions across the world, or innovations across the world, like Friendship Bench. We have gathered enough evidence over the last couple of decades to know what works. What is really missing today is the knowledge on how to scale these innovations. Let me end with loneliness. Loneliness is a big problem. And at Friendship Bench, what we've learned is when the grandmothers provide therapy on the bench, we are also addressing loneliness, because the grandmothers get a sense of belonging and a sense of purpose in their communities. So I think the take-home message is communities actually have a lot of resources to address some of the most challenging public health problems that we have today. And I hope that will help you to start thinking outside the box about what we can collectively do. Thank you.
Thank you, Dixon. That is actually really poignant. I have a teenage son who struggles a lot with mental health, had a particularly bad week last week, but he's staying with my mom, his grandmother, while I'm here, so you're making me feel a lot less guilty about leaving him behind. Well, I would love to introduce to the stage our first panelist. We have Lady Rosalind Murata, who's the chair of the board for the Global Fund, and Janet Murguia, who is the president and chief executive officer for Unidos US. Welcome to the stage. Thank you both. So today we want to talk about the impact of community health workers. So I have a question to kick off with both of you, but I'll start with you first, Lady Roz. As I mentioned earlier, I think we came to really appreciate the critical role community healthcare workers play during COVID. You know, they're on the front lines, they know their communities and local contexts better than anyone, and they're often the ones charged with implementing a range of new health innovations, be it new services, delivery methods, products. So Lady Roz, can you briefly share some examples of how community healthcare workers support reaching the most vulnerable through life-saving innovations?
Thank you very much, Kate, and good afternoon, everyone. Community health workers are the backbone of an effective health system. And as you said, COVID really brought this home to us all over the world, how much we relied on the frontline workers. In the current grant cycle of 2021 to 23, Global Fund has invested $583 million in community health workers, which is more than double the investments of the previous period. And in the next 3-year period, starting next year, our investments in community health workers will almost double again to $1 billion. It's great to see that many countries are increasing their investment in community health workers. And we have an increasing number of examples of countries improving health and well-being after investing in these kinds of interventions, specifically on community health workers. Countries like Liberia, Malawi, Rwanda, Cote d'Ivoire, Zambia, Mongolia, Ethiopia. I'll just briefly outline what's happened in Ethiopia, because I think it's an outstanding example. The health extension program is one strategy adopted by the government, with a view to achieving universal health coverage of primary health care in the rural population in a context of very limited resources. And this started back in 2002. There are key vehicles for the implementation of the health extension program. First, health extension workers, who are community health workers deployed to the villages, the cabeles. Second, families trained within the communities. And third, the Health Development Army volunteers who were mobilized. I love the term, the army. Ethiopia's initial scale-up of this program was funded by the Global Fund. And today, Ethiopia's community health system includes 40,000 salaried health extension workers supervising 4 million Health Development Army volunteers. And this program is widely credited with improving Ethiopia's health outcomes. 2-fold increase in immunization in the period, 2.5-fold increase in contraceptive prevalence, 10-fold increase in skilled attendance at birth. So this has demonstrated that an institutionalized community approach is effective in helping a country make progress towards universal health coverage. The element of community mobilization identifies community priorities, engages and empowers community members, and solves local problems. Then we need the element of institutionalization, addressing the challenge of sustainability faced by community programs, ensuring high political commitment, coordinating national policies, and leveraging support from partners.
Yeah, and so thank you for giving that example in Ethiopia. And Janet, you work with the Latino population here in the US. Maybe you can share some examples of the power of community healthcare workers in reaching that population.
Yes, and I think we've seen and heard a little bit represented by our panelists here and our opening speaker. I mean, when it comes to the power of community health workers, in the Latino community, we often refer to them as promotores de salud, lay health workers. It's really, the core issue is trust, language, cultural competency, and being in communities. At Unidos US, we engage a network of about 300 community-based organizations across the country. And we work with them to develop the right programs and services, but also advocacy on behalf of the families and individuals that they serve. Today, at the heart of these community health workers, we have seen their effectiveness translate into signing up Affordable Care Act recipients, helping folks navigate and access the system, especially now that we're dealing with Medicaid unwinding and the complete difficulties and bureaucracies that families have to go through to maintain coverage. Maybe it's signing up for SNAP, the Supplemental Nutritional Assistance Program. The digital divide has created all kinds of barriers that we see really reflected in the systemic racism that is incorporated across so many areas of access to programs and services, because so much of the information that our community needs to rely on is online. So these community health workers are helping to break down those barriers. But we're finding that beyond the structural racism, it's that lack of access to affordability, the lack of cultural responsive providers, scarce transportation, language barriers, and most recently exacerbated in the pandemic, misinformation and disinformation targeted to our community, which has resulted in taking advantage of a community that didn't have all the digital literacy they needed for vaccines and understanding that. So these Lay health workers have played a critical role and are filling a critical gap when the Latino community is growing. We represented 50% of the growth of the U.S. population. We now are at 62 million. We represent almost 20% of the U.S. population. And when the professions in the health profession and industry are lacking in that representation, you see the bridge, the gap that these individuals, when well trained and supported, can make a huge difference. I can add more about that training, but let me stop there to just give you a sense of the lifeline, literally, that these promotoras really create when it comes to connecting our communities to important services in health.
Yeah, and so they do provide this lifeline, yet are still lacking a lot of the financial support. You talk about the digital divide, lack of access, and that's probably challenges that no matter where you're working in the world, you can resonate with. And later, as last year, the Global Fund, in collaboration with Skoll Foundation, Johnson & Johnson, and the AFF Initiative, launched the Africa Frontline First Catalytic Fund. And this fund provides $100 million in financial support to accelerate and sustain the scaling of community healthcare workers. Can you talk a little about this fund and how it can be used to address some of these challenges Janet outlined?
Thank you, Kate. Africa Frontline First Catalytic Fund is one of the largest efforts involving multi-private sector philanthropy. Designed in partnership between the Global Fund and the AFF Initiative, with $25 million in total from Johnson & Johnson Foundation and the Skoll Foundation, this fund aims to transform the work of 220,000 community health workers in 8 African countries: Burkina Faso, Côte d'Ivoire, Ethiopia, Kenya, Liberia, Mali, Senegal, and Zambia. Transformation happens by strategically investing in 5 system domains to support in the long-term community systems and their links with primary health care. Financing for long-term sustainability, rooted in government financial plans, blending domestic and donor funding. Human resources for health, to develop and professionalize community health workers to be paid, supervised, supported, and integrated into the national health workforce. The third is leadership and governance, to assist government leadership in developing and implementing clear policies, processes, and structures for health system strengthening. Fourth, digital tools and information systems to facilitate digital transformation across the whole community health sector. And fifthly, supply chain work to develop regular forecasting and guarantee the availability of essential tools and equipment. We're really proud of this catalytic fund, as it will accelerate and advance community health in countries which have a different maturity level to start. But it's not the only catalytic fund or investment in support of community health workers that the Global Fund does. As I mentioned before, we'll spend nearly $1 billion in community health worker programs over the next 3 years. These investments will support training, supervision, supply of key materials, health products and digital tools, means of transport and PPE, as well as advocacy, to give community health workers the legal protection and recognition they deserve. Overall, the investments will accelerate health impact in the 120 countries where we work. Kenya has shown this is possible. Country contexts are very varied, but in all countries, we need to support both the short-term maturity of the system and build confidence in the long-term sustainability to get the scale.
Thank you. And Janet, so when we think about how we can better integrate community healthcare workers into our health system, we've laid out some of the challenges, some of the ways that we can support through financing, through training. What would be your advice for people in the room? And I'm sure we have people here representing all different kinds of backgrounds, potential stakeholders, but for the role they can play in advocating for more support for community health workers and integration into the health system.
Yeah, I think it's twofold. One is we need more investments, federal and state, but there are training programs that I know the Department of Labor has been working on, and most recently the Biden administration did invest some significant dollars to allow us to have training, but also the need for credentialing. Right now, the standards across the country vary based on a few states, very few, who've actually attempted to help credential some of these different levels of work. But we really need federal standards. And to create an expanded professional pathway, career pathway for these folks, not just to be relied upon as volunteers in a system that desperately needs these gaps filled, but to actually show and demonstrate their value, because for every $1 that we invest in a career health worker, we get at least $2.50 back. And in many communities, that is an enormous asset for our underserved communities. And we're seeing really the need for federal investments, state level investments, but also for this credentialing. I know for us at Unidos US, we've worked with our affiliates, at least 3, to do registered apprenticeships. And that is one really effective way both to train but also serve at the same time and get really a lot of outcome for the investment. Those registered apprenticeships need to be scaled in a way and then expanded so that we can see more and more communities served and supported. Our affiliates are really doing a lot. Just 3 of them have helped train at least 1,000 registered apprenticeships that have now been certified as community health workers.
And you really lay out the financial case for this, right? It makes economic sense in so many ways. And Leda Raz, when we think about that return on investment and helping to make that case with potential funders, I'm also thinking about, you mentioned a lot of the healthcare workers, but many of them being volunteers. Again, most are women. Many are doing this at significant health risk to themselves, right? How can we go about using that return on investment case to make change and get these workers paid what they deserve, and in a system that can support that kind of compensation?
Well, I think I already outlined the answer to that question. Ethiopia is a good example where the community, the volunteers have been brought into the workforce and are paid. They receive something, even though they're called volunteers. Yeah. But governments have to take this on and recognize that the amount of money that they spend on community health workers has enormous return on investment, probably much greater than a doctor. And
my mother's a nurse, would say the same.
Yes. So there are examples around the world where it has been institutionalized. It's not easy, very hard for governments to take on non-government workers, but we need to use the examples and try to get them to scale.
Yeah, and Janet?
Yeah, I just want to offer a couple just thoughts on, of course, we need to support these community health workers and provide funding and credentials, expanded pathways. But when we've talked to our community health workers, our promotoras de salud, they mentioned 3 things that would be extremely helpful when dealing with particularly the Latino community, but communities across the country. And that is one of the areas you heard about already is mental health. Our young Latinas are suffering suicide rates higher than the norm right now, and we've seen that in some of the recent statistics by actual HHS reports. The level of poverty is still something that is our communities confront, and there are some tools like the earned income tax credit that could be expanded, that have been proven ways, the child tax credit, that have lifted communities out of poverty. That would go a long way to help dealing with health issues. And then the last piece, especially for the Latino community, because fear is a big part of mixed status families who still are undocumented. We need immigration reform. The way that folks are weaponizing undocumented folks to be fearful, even though the laws are clear that they can apply for SNAP and other benefits, it's really harming our ability to help families who are qualified to receive help. And so advocacy and the voice of everyone here for these broader investments and reforms would be critically important to helping address so many of the issues that our community health workers face today.
Great. Well, thank you. That's probably a good note to end on. I know we were just able to scratch the surface, but thank you so much, Janet and Lady Roz, for your time today. I would now like to direct your attention to the screens for a short video.
From 2000 to 2008, 2010, the Ministry of Health and the government have been investing a lot in making sure that the poorest among the population is provided access to all health services that they deserve. In that work, we have been a key partner. We supported the construction of hospitals, and we are training the future healthcare providers at the University of Global Health Equity in Burera.
We need more people educated to provide quality care for the vulnerable across the world. UGHG is there for that. Our students will have state-of-the-art education in clinical practice, plus strategic thinking and social determinant knowledge to make sure that the patient they will have the most of the clinical service they will give. The education is free of charge at one condition. During 6 to 9 years, they will serve public good in direct service delivery for the vulnerable.
We are oriented such that our students are patient-focused, they are community-oriented, and they are globally aware. And we cannot train quality health professionals without a hospital where our patients go to. So we have, for me, 3 universities. A university with walls in the form of UGHE. We have a university with patients, which is Butaro Hospital. Then we have a university without walls, which is the community.
Coming to UGHG was really inspiring because I know I'll be in an environment that is incredibly supportive, and I'm inspired to pursue more, drive myself further, know that I can also contribute to the world effectively.
I really see UGHE as a satellite of light where we are teaching the future Rwandan health professionals to take care of the Rwandan population. Further than that, this is a beacon of light and a satellite for the East African region and for the continent. It's an opportunity and a responsibility that as PIH we have, as UGHE we have, as Butaro Hospital we have, and as individuals we have, that we give the baton in the proper way to the next professionals who will be the carers of our world.
Thank you. I would now like to introduce to the stage Liz Smith, co-founder and CEO of iAlliance.
I want to tell you a story about an 8-year-old girl. She was in the 3rd grade and she was having difficulty seeing the blackboard clearly. She wasn't able to copy down anything that the teacher was writing on the board, and she couldn't understand why the other students weren't having the same problem. Soon she started to fall behind in school. But that summer, the summer before 4th grade, she got her first pair of eyeglasses. And the 4th grade turned out to be very different for her. That little girl is me, and I was lucky to get those eyeglasses when I did. I co-founded iAlliance to ensure that all boys and girls and adults can get the glasses they need to see clearly. And we're not out there alone. The EssilorLuxottica company has donated millions and millions of pairs of glasses for those who cannot afford them. The WHO is launching a new initiative called Specs 2030, exclusively focused on improving access to eyeglasses. And iAlliance works closely with UNESCO's International Institute for Capacity Building in Africa and the Clinton Health Access Initiative to enable governments to become the implementers of school-based programs. Today, iAlliance is making a commitment to collaborate with ministries of health and education across 3 African governments. We will enable them to scale school eye health at national level. And teachers will play a really critical role in this work. We will train teachers to conduct basic vision screenings on-site and in schools, and those teachers will then be able to identify the children who need to be seen by an eye doctor. Now, this particular intervention was pioneered decades ago by NGOs, but when ministries take the lead, it is one of the most cost-effective interventions with immediate impact on educational outcomes and test scores. Universal school eye health is something the global community can achieve. This is doable, so we invite you to join the movement. Thank you.
Thank you. I'd now like to welcome to the stage Didi Bertrand from Partners in Health.
Good afternoon. So I was given the honor to introduce a number of commitment markers. But before doing that, I would like to, first of all, thank the last members of the panel, because I had the privilege of working in Rwanda for 10 years, running a community health worker programming for Partners in Health, for our sister organizations in Rwanda, in Nshuti-Mubuzima. And I know, what you've been talking about. It's been really a long fight to integrate community health workers as a key member of the health system. And it is about time for us to have a team and the integrated team approach to consider community health workers as a doctor, a nurse, and any other provider of the health system. So I just wanted to put that out there, and I'm going to fulfill the responsibility that was given to me. So, and I really appreciate the doctors also intervention around mental health, because I work with adolescent girls, and mental health is another issue. So next month, for example, October, is the WHO dedicated this month for, to raise awareness on mental health. And it is one of the months that, only month we focus on bringing awareness, but it's something that needs to be done every day with the resources that we have in the community. So I'm thanking you as well for all you do. So I wanted to say that. Thank you very much. Okay, so 130 countries. Maybe I should start by calling the different commitment makers. So number one, we have Adrienne Gardner from APATH Consortium. We have Leonie Hackett from Healthy Learners. We have Sally Perman from International Confederation of Midwives. Maria Fernanda Levi's from Impactivo. Anne Stick from Medtronic Labs. Jiwon Lee and Dr. Julia Songkok. And Caroline Millen from Summit Education. So 130 countries report a shortage of physicians, and more than 150 countries have a shortage of nurses and midwives. The critical need to increase the capacity of the full spectrum of care providers from health systems to lay and community health workers is before us. Such an expensive global problem will require diverse partnership and innovative collaboration, but the CGI community has committed to rise to this challenge. The commitment markers here are using technology, education, and investment to help both formal and informal health providers deliver comprehensive quality care to communities across the globe. Impactivo is committed to increase access to telehealth and support health providers across Puerto Rico by partnering with a rural primary care center and the Puerto Rico Department of Health. Impactivo will also offer training on patient-centered virtual care for healthcare workers and help 10 healthcare centers in rural or underserved area implemented telehealth. Could we give a round of applause to Impactiva? Summit Education is committed to launch a school-based health and nutrition support program in Haiti. Schools are trusted centers of the community. We'll offer primary care services, preventative care, sexual and reproductive health education, and mental health care, as well as nutrition and food security services. A round of applause for Summit Education. Health Tech Without Borders is committed to launch Project Vital, the virtual international telehealth and leadership project, to create a sustainable and culturally relevant telehealth program in Cameroon. This locally led telehealth platform will increase healthcare workers' capacity to provide high-quality care in climate and conflict-affected communities, while also protecting patient information. Please, a round of applause to Health Tech Without Borders. The International Confederation of Midwives is committing to invest in midwives association to increase the capacity of midwives to provide care to improve newborn and maternal health outcomes. Through country-specific needs assessments and leadership trainings, this commitment will empower Midwives Association to advocate for involvement in health systems and health policy decision-making. A round of applause. Medtronic and Medtronic Labs are committing to use technology to deliver integrated primary care to 50 million people locally. A country-led consortium will drive the implementation of digitally integrated primary care systems dependent on the country's need. Round of applause to Medtronic Labs. Healthy Learners is committed to implement its school-based health model to reach 1.2 million students in Zambia by 2026. By training teachers as community health workers, schools will promote healthy behaviors and provide basic care for students, and refer 6 students for further treatment. As trusted community hubs, schools present a cost-effective way to provide ongoing health services for school-age children. Empath and its partners are committing to provide workforce training and multilateral exchange program for community health workers, nurses, social workers, and other members of the primary care workforce to increase their capacity to provide care within existing health systems. So these commitment makers are leading the way for better patient health outcomes in the long term. I hope you will join them in their innovative approaches to healthcare workforce training and delivery of care. So now we have a certificate that I think we need to present and take a picture with everyone. So that's
Well, great to hear all of those commitments to action. Thank you all so much. Well, we are going to continue the conversation with our next panel, and so I'm delighted to welcome to the stage. We have Dr. Yadira Villaseñor, who's the Regional Director for IntraHealth International, Owen Alinde, who's Vice President of Global Strategic Initiatives for Starkey Hearing Technologies, and Gregory Roxon, who's co-founder and Chief Executive Officer for Pharma. So please join me in welcoming them to the stage. Thank you all for being here. So you each work on initiatives that help support community healthcare workers. So I want to hear a little bit about each of them. Dr. Villaseñor, we're going to start with you. You work in Central American region and integrating community healthcare workers into HIV facilities, also with maternal, newborn, and child and family health. Can you share a little bit more about the projects you work on and the importance community healthcare workers play in the work that you do?
Okay, thank you. It's a pleasure and an honor to be here representing Central America. You know, many years ago, I started working with the indigenous population in Guatemala. And there we learn a lot from traditional birth attendants and community promoters, you know, and we integrate them to the facilities in order to provide more cultural and appropriate services. In another hand, actually, we are implementing a care and treatment HIV project with the financial contribution of USAID and the technical support of IntraHealth. So we develop a more robust approach integrating community health workers to HIV facilities. So they provide direct delivery services to people living with HIV, such as emotional support to them, linkage new positives to facilities for early treatment, provide treatment through differentiated models of care, recovery people who interrupt their treatment. So there is a lot doing at facility level, and IntraHealth build the capacity of the whole facility We train them, the community health workers, but more important is that we listen and we learn from them in order, to provide comprehensive services to people living with HIV, and for them, to be more confident to the health facilities.
Yeah, for sure. Owen, I would love to bring you in and talk a little bit about how Starkey Hearing Technologies, you provide hearing aids, other hearing devices. How do you incorporate community-based initiatives into your approach to healthcare?
Absolutely. Thank you, Kate, and thank you, everyone, for attending this session. So I'll first start off by talking about hearing and hearing healthcare and hearing loss. I mean, hearing is one of those things that people don't talk about in conversations, but it has a tremendous impact in our lives one way or another. So if you talk about WHO statistics on hearing loss, globally right now, we talk about 430 million people with disabling hearing loss and about 1.5 billion people with some form of hearing loss globally. And by 2050, WHO estimates over 700 or up to 950 million people with hearing loss. That's not a small number. And if we talk about the community-based healthcare, the largest population that's highly affected by this is in the developing world. But hearing loss is something that impacts us all, whether in the developed world or in the developing world. Now, Starkey Hearing Technologies is a leading innovator and a manufacturer of hearing aids. We develop some of the most advanced hearing aids you can find right now in this planet. And one of the things that drives us the most is not just the technologies that we develop and what we incorporate in it, but the people that actually benefit from that technology. We focus on caring, and caring can only be delivered through people who understand the impact of what hearing does. So through our devices, we are able to interact with different partners around the world, and through our corporate social responsibility called Starkey Cares, we're able to connect with partners, some of our customers, and different stakeholders in supporting community healthcare workers directly or indirectly through capacity building, provision of support through empowerment and technologies, and donating free hearing aids so they can provide the much needed support and access to the hearing aids which otherwise is not available in those communities. So as a company, we are driven by a purpose, and our purpose is to create access. And we can only create access by empowering the people who live in the community, who know what the community needs are, and also working with stakeholders that also understand what the community needs could possibly be and how we can leverage that support to scale up. And that's what we do as a company. Thank you.
Right, so Gregory, speaking of access, you're CEO of Impharma, a company that transforms small pharmacies into healthcare centers across 9 countries in Africa. Again, I think many of us probably experienced during COVID the power of pharmacies, and that was an easy place to go to get healthcare, and it's a really powerful approach that you all are doing where you're seeing a lot of great impact. I think you're reaching over 2 million patients. So can you share a little bit about how Impharma and your new subscription plan that provides healthcare and medicine for under-resourced communities, how you approach that?
Yeah, thanks. Actually, it's great that you mentioned the pandemic, because when we think of how the US government could be able to quickly make COVID vaccines available to a wide majority of the American population, it was because it relied on community pharmacies, right? 90% of the American population lives within 5 miles of a community pharmacy, which is why community pharmacies are the most accessible healthcare providers in the US. And this narrative is even more prominent in the countries that we work in Africa. In Ghana, we once did a survey, and we asked Ghanaians between a community pharmacy, a clinic, and an informal healthcare facility, which one do you visit the most? And 55% of respondents picked the community pharmacy. However, if you go to a community pharmacist and you ask them, are you a primary care provider? They'll say, no, I just sell drugs. And so we saw this really amazing opportunity where there's this powerful utility that lies within community pharmacies, but the community pharmacies themselves don't see that utility. And our idea was simple. What if we could build technology the processes and the infrastructure that can allow us to use community pharmacies and transform them into the front door of a healthcare system. Because already people trust their local pharmacy. People rely on it. And during COVID, when people were afraid to go to the hospital, they turned to the community pharmacy as the first point of call. And so across the continent, what we've done is we've invested in hundreds of pharmacies, and we, after investing in them, build clinical care infrastructure so that we can create new care pathways that allows that pharmacy to go beyond just selling medicines. Now that pharmacy becomes the family physician of the community, because we hire community health nurses that we allow them to join the staff of the pharmacy, so that when you go to the pharmacy, you can actually see a community health nurse who can be able to check your vitals, and if they feel a doctor should join that care intervention, they can send a request through our telemedicine service, and the doctor can join remotely with the assistance of the nurse to treat that patient.
Well, I love that, because you are addressing a couple of the barriers that were mentioned, the trust and access, both so important. So Dr. Villaseñor, can you talk a little bit about how you can advocate for local governments to invest in community healthcare worker trainings, capacity building, overall integration into the healthcare system? What have you found successful in the work you do?
Okay, we support different levels of authority, national and regional and locally, because that integration is very important. So we support them and deliver their capacity to analyze their context, to identify gaps and opportunity to perform better. And we try to advocate for formalize the role of the community health workers at all levels, at community and facility level. And to IntraHealth is very important, the data manage and analysis for decision making. So we advocate local authorities to really analyze the data, and we show results of improvements and progress in HIV when community health workers are engaged. So you know that PEPFAR indicators are strong, and we need to achieve the 95s. And we show good results with the participation of the community health workers. So we do a lot, but showing results.
Love it. And Owen, I would love to hear your thoughts on, we talk a lot about the importance of building trust, right? Of knowing the community, knowing the language, the cultural context. So would you think about, as a company working with community healthcare workers, how to localize your programs within those specific communities and how to adapt to those? How do you think about that?
So when you talk about the community, we're talking about the people who live and serve their own respective people. They know their people, they understand the nuances, they understand the different ways of how they can communicate and educate their own. And one thing that we do as Starkey is we integrate into the community. Whether it's in the US, whether it's in the Philippines, whether it's in Kenya, whether it's in Ghana, one of the key things we do is before we come in to roll out a program, we first connect with the community to understand what their needs are. And using the innovation and the expertise that we have, we create something that actually works for that particular community. So because they know their people best. So that's the most effective way of building a sustainable, robust program that has a sustainable impact. And as a company with decades of experience, we've always thought of it from the bottom-up approach. And one thing that we do very well is we don't just give fish, but we teach them how to fish. And by providing those assistive devices, we also build capacity at the same time. And that goes a long way in effective sustainability. And we also engage different stakeholders in impacting policy, in building sustainable approaches with public health outcomes that will help promote knowledge about hearing and hearing healthcare, because as I mentioned, the stigma about hearing healthcare exists, not only in the developed world, but also in the developing world. A lot of people shy away from wearing hearing aids. I'm actually wearing hearing aids right now, even though I don't have hearing loss, but it's something that we as a company want to make and let people know that we have solutions that can support hearing healthcare, and that in turn will support different health markers. And we talked about mental health, we've talked about social isolation, which Dr. Chibanda mentioned. And not having hearing disconnects you from not only your loved one, but your environment. And I think that has a detrimental impact on your general well-being and health as a person. So as a company, we're really focused on really building that strong foundation, which starts with the community health workers and the community base, to have a really sustainable program. Thank you.
Thank you. And so, Gregory, I want to talk a little bit too about this working with governments and funding and coming up with a retail model to address a real need in the communities. How do you work with local, national governments, and how's that experience been for you? What more would you like to see them do in working with groups like yours that are trying to make pharmacies or other approaches to delivery and access more prevalent?
Yeah. Well, 2 years ago, we signed our first public agreement with a government in a country called Gabon. And as you may know, a few weeks ago, the government was overthrown in the coup d'etat. So that is some of the risks that comes when you pursue partnerships, particularly in very volatile environments. You don't know what would lead to that partnership, maybe season or not. Our view at M-Pharma is that we have to have a dual focus. We have to be both complementary to the government, but also competitive to the government. Now, it's sometimes weird in the audience say, why do you want to compete with the government? But I believe that competition brings the best out of everyone. And unfortunately, we have found ourselves with a national health system that has been so government-driven, government-focused, that in a way, it doesn't make government set up, because for most of the communities, the only option that people have to any type of healthcare delivery is what the government can provide. But if we can flip the switch, where we can create alternative pathways using innovative technology that actually enables people that live in these communities to have options beyond what just the government does, then it puts pressure on the government, because the next time you go try to get them to vote for you, you have to answer to them, why is this alternative much better than what the government provides me? So that's the competitive side of how we look at the work that we do. And then there's a complementary side, right? Because we also do know that with the tight budgets that most governments are facing, and with the rising populations that we are seeing, that the government can't do it by itself. And so we actually believe in the power of creating tax shifting models where, for example, in Zambia, when the government launched its national health insurance scheme, it knew that all the public health facilities would not be enough for this new surge of patients who, because they have a national health insurance system, would want to seek care. So the government came to us and said, can we integrate your pharmacies into our care delivery network? And we said yes. And so in that way, we are complementary to what the government does.
Thank you. And Dr. Villaseñor, what advice would you have for our audience here on ways they can partner, invest, support community healthcare workers in their own communities?
Okay, there are a lot of challenges, but let's see them as opportunities. So in one way, how community participates with the health system and health facilities. And then, in the other hand, how the health system make it accessible to the communities. So I think that between these two opportunities, there are the health workers and the community health workers. Those are the ones that will make the difference because they will link community with facilities in a better way, and they know for sure what the needs are at community level, and they will represent the health system at their communities. So I think that it's important to continue investing in the health workforce. And as IntraHealth, you know that we are part of the Frontline Workforce Coalition, so we will continue supporting health workers. I think that is the most valuable resource of the entire health system. So please continue investing and supporting health workers.
Thank you. And I know we have some med tech companies in the room here. What advice would you have for them on how they can better support and work with community healthcare workers?
So actually, that's very simple. I mean, we develop a lot of technologies out here in the developed world, and then try to, trickle it down into the developing world. One thing I definitely, as a company, I'm proud of is the technologies we develop is meant for everybody, from the community aspect all the way up to the top. So how do we embrace technology and innovation to support where there are gaps? And when we talk about a developing world, the access of professionals that support, for example, in hearing healthcare is very low. So we're using technology to bridge that gap. Having telehealth, telehearing health is a critical piece. And of course, embracing learning through, virtual, that will enable access even in the remotest of remote areas. Because to be very honest, right now, internet access pretty much goes well into the communities and that, otherwise would have not been reached by roads or any other thing. So how do you embrace technology to really build that access and create that level of sustainability from a community level? So one thing Stucky does very well is, as I mentioned to you previously, is the empowerment of the community healthcare workers, and us leveraging the support of our customers and our partners on the ground to help build that network. And with that network, we're able to train effectively, efficiently, also build the capacity and provide the necessary support and resources to help those communities really provide that service to the people who need it the most.
Thank you. And Gregory, your advice for other retail clinics, people in the room, or other stakeholders that maybe are involved in pharmaceuticals, what advice would you have for them on how they can better expand access to healthcare?
Yeah, I kind of end on a gloomy note because, between 2001 and 2022, Nigeria lost over 7,000 nurses who all left for greener pastures. Last year alone in Ghana lost over 4,000 nurses who all left the country in search of greener pastures. And the situation will only get worse. It's not going to get better. And so at the end of the day, if we then look at the fact that we have a disease burden that is shifting from an infectious disease marker to non-communicable diseases being the leading causes of death, then we have to actually start throwing away the rule book and saying we cannot train new healthcare workers fast enough. So we need to start upscaling existing healthcare workers with new skill sets that allow them to step in to close the gap that currently exists. When I look at what we've done with community health nurses, upscaling them and now making them manage virtual doctor offices within community pharmacies to close the gap for those communities. Those are new approaches that I think we should all be thinking about and looking at how do we really ensure that the healthcare workers that remain, we can upscale them and use to create new care pathways for these communities.
All right. Well, thank you, Dr. Villaseñor, Owen, and Gregory, so much for sharing your insights with us today. Thank you.
Thank you.
Thank you. Thank you.
So on the continuing theme of upskilling and education, I would like to introduce to the stage Mrs. Raj Saxena, who is the president for the Hillary Clinton Nursing School at Vinod Gupta Charitable Foundation.
Namaskar, everyone. That is good afternoon, ladies and gentlemen. I would like to take you back about 60 minutes or a little more than that, back into your memories as we started the program. There was a movie which was showcased, and it was a short film on Hillary Clinton Nursing School. We hope that it touched your hearts because it has been made with a lot of passion to be able to tell you what is happening in a tiny village in India, in the state of Uttar Pradesh, and how it is changing the lives of a girl child and changing society at large. The film said it all, but I just wanted to add that Hillary Clinton Nursing School has been ranked as #1 in the state of Uttar Pradesh in India, out of a population of 230 million, where it stands tall and bright. The girls who are passing out are getting jobs, and they are changing the life of their communities by earning good salaries and supporting their children and the village people and their families to have a new life. We would like to thank Hillary Clinton for inspiring us to educate the village girls. These girls will change the lives of many generations to come and positively change the society. Ladies and gentlemen, it is truly said that it takes a village. It takes a village. It takes a village. And the will to keep going on even stronger. Thank you for having me here this afternoon. And before we end this, I would like to just point out, there is a gentleman here in the audience, Mr. Vinod Gupta, Laurel ma'am, and Tanaya Sharma, who are the board members, who deserve more applause than any one of us for making Hillary Clinton Nursing School happen and Bill Clinton School happen. Thank you. Thank you for having me here.
Thank you. I'd now like to welcome to the stage Carlos Caldeira, who is from the Ministry of Health in Brazil, for some closing remarks.
Good afternoon. It's really a pleasure to be invited to be here in this closing remarks part of the event. I could see the conversation and the ideas, and it was very, very good. I'm also very happy to be representing the first Brazilian woman health minister in the whole history of the health ministry in Brazil. It's not by coincidence, but it's a government policy to include a woman, to consider race, to consider inequality between people in the whole health policy. I'd like to emphasize only 3 points here that I think it's important. First, inside the health ministry, we have a program for the workforce centered in the woman to reduce race inequality, gender, and the ethnic inequality. It involves more than 2 million people in this program. It was launched, and now it is working very well. And at the same time, it's very difficult to take this into consideration, considering the size of the Brazilian country, the Brazilian population, but it's a very, we are very enthusiastic with this program. The second one that I think there is a very close relationship with all of we have been discussing here is a program to attract health professionals to vulnerable and to remote region. We relaunch a program centered in more doctor, but not only. They are linked with our primary care system involving many types of health professionals. Nowadays, more than 4,000 municipalities was covered by this program with more than 30,000 doctors, and the team that involved more than 100,000 people, only to take care of people, and mostly vulnerable people. Third, and this is a completely breakthrough, health was selected by the Brazilian government as one of the 6 main areas of development, of economic development, of innovation development, of science development. We are now trying to break the walls between the social field, the economic field, and the environment field. We will launch this program in this month, the end of this month, and we could stimulate around 9 million people to work in the health field in a dignified way, formal workers with better jobs, health as a part of a different model of development. Finally, I want to emphasize that we think all the time how to take care of our caretakers. We must, after the pandemic, to consider this kind of professional as jewel, as they are worth a lot for us. They are very important for society, not only for the service, but for a kind of society motivated, stimulated by solidarity. Health professional is a way of solidarity. Then it's really a pleasure to be here, to bring here this message. That's not a message only from Brazil, but it's a message that Brazil wants to discuss in the global health perspective. Thanks a lot.
All right, thank you so much. Well, that concludes our program for today. I want to give a special thank you to all of our panelists, to all of those who made a commitment to action, and to all of you for caring about this important issue. Whether you work on this directly or not, I hope you leave today's session inspired to really fight for and advocate community healthcare workers as a critical part of our healthcare system. Now we have a few minutes for you guys to network, get to know each other, catch up with friends. Again, thank you for joining the session. Have a good rest of your day.